Welcome back. In the ongoing debate over how to fix healthcare in Canada, a new effort tackles the issue head-on with a fresh approach. Instead of relying solely on experts and policymakers, the initiative asked a group of patients, people who don't work in healthcare, to come up with solutions, from which a report outlining several key recommendations emerged. Now, Dr. Kiran, you're one of the leads on this project, or you were the project lead. Talk about the motivation behind it.
Yeah, so I mean, I've been involved in healthcare discussions, reform discussions for, almost 2 decades now. And I'd say you see very little change happening, some change, but not enough. And often when you have these discussions, who's at the table? It's maybe doctors, other health professionals, researchers, administrators, but all too often the people who really should be at the table are missing, and that's the members of the public. And I really felt that by bringing the members of the public to the table, we'd be able to, I hoped, crack through a different perspective. Often we do actually have vested interests when we have the other people around the table. Here we'll have a fresh perspective. So what is it that members of the public really want in our system?
Right, what were some of those key recommendations then?
I will say, people recognized how important primary care was and that we needed to have a system that worked for everyone, so everybody had access to a family doctor, nurse practitioner, or primary care team. Mm-hmm. And so how did they recommend doing that? Well, they recommended expansion of current team-based models. They recognized that that would be better for patients, it would be better for providers, and it's the only way really that we'd be able to provide care to everybody.
So is that so that there's continuity? If a doctor retires, then their patients will be transferred to another doctor? Is that the idea?
I think there's many different reasons for teams. So one is that right now we actually simply don't have enough family doctors and nurse practitioners to be able to provide everybody with an individual clinician who can look after them on their own. However, if we bring in other health professionals, whether those are pharmacists, social workers, physiotherapists, or others who are working together with us, we can grow our capacity as a family doctor, let's say, to see more patients.
Dr. Whatley, 2 million Ontarians are without a family doctor. How it has to happen to fix that discrepancy here?
So huge issue, difficult to answer in a few words. I would argue that we don't have an absolute lack of family doctors. We have a relative lack of family doctors. Some specialists, absolutely, in Canada, we don't have enough pediatric neurologists. So subspecialists, we are short of actual absolute numbers. But if you look at the number of patients that family doctors could care for, even 10 to 15 years ago, it's double the number that they're able to care for now. Now it's considered to be in full-time family practice if you're somewhere between 1,100 and 1,500 patients, whereas in the past it was common to have 2,000, 2,500 patients. We don't allow family doctors to leverage their skills by expanding the number of staff that they can hire. Instead, the government forms arbitrary teams, brings together all these allied providers, which is great, but that's not how normal teams grow and function. It's still the physician who gets sued. The legal system holds physicians to account. So we found that family health teams, for example, in Ontario, cost 60% more per patient compared to those rostered to the traditional family practice style.
I'd just take issue with a few things that Shawn said there. So I'd say that, there's many reasons why actually family doctors aren't seeing as many people in practice today as they were in previous years. They range from everything from people becoming more complex to the medicine, like the medicine and the amount of medicine we need to know to address people's becoming more complex, to actually people also making lifestyle choices as family doctors that they don't want to work as much as maybe they worked 20 years ago. But I will say it also, I'm not familiar with the numbers that Shawn has put out, but I don't think the numbers I've seen are not that teams are ludicrously more expensive. In fact, if you had $100, I think, roughly per person in Ontario, you could expand team-based care to everybody. And I'd say most people would be willing to do that if it meant that they would be having a family doctor.
Erin, you were a nurse on the front lines. How did you see this shortage affect patients, and what would you think would be the solution here?
I would think in a day when I would triage over 100 patients in the emergency department, the vast majority of them were without a family physician, which is really actually overburdens the emergency departments in Ontario. But I would like to tag on to what you said, Dr. Whatley. Nurse practitioners are held to account. They are accountable to our college, and also they face legal litigation issues, if you will, as well. They are autonomous practitioners in their own right, and they are a valuable part of any family health team. I can say quite often we had referrals from nurse practitioners in the community. But it is also important to look at what you touched on, the complexity of the patients, that the capacity within the hospitals. Patients are being discharged earlier. Patients are being sent back to primary care. And it does impact your ability to see as many patients in a day. I think a family health team is a step in the right direction.
The other thing, and I would be remiss to not bring it up, that was interesting that the survey uncovered was that patients were frustrated about not having access to their medical records and issues around electronic medical records and why we don't have a proper system in place. But we'll have to leave it there. We'll be right back with more.